Thank you once again for joining me on the program, Your Doctor in COVID. I'm Dr. Mahendra Carpen. I'm the Head of Medical Services and Cardiology at the Georgetown Public Hospital Corporation. We continue our conversations around the COVID-19 pandemic as it continues to wreak havoc across the world. We in Guyana have not been spared, and we are no strangers to the effects of COVID-19. Over 400 persons, 400 of our citizens would have died from COVID-19. So it has touched at least 400 families in Guyana. If you have any questions or comments about COVID-19, please feel free to send a WhatsApp to 620-6275 or send an email to docandcovid@gmail.com. As usual, I'm starting off here by wearing my mask to cover both my nose and mouth. But I'm taking them off now using the straps around my ears so that we could have further conversations. Remember, the risk is greatest if you're within 6 feet of someone who is not in your usual close circle of contact or friends, and neither of you are wearing masks. So we encourage that you continue to maintain social distancing, continue to wear your masks when out in public, and continue to wash your hands and sanitize your hands as often as possible. So one of the big things that we've become worried about, increasingly so in recent months, is the presence of what is known as COVID-19 variants. So we started off with an original virus that seemed to have originated somewhere in Wuhan, China. That virus has spread across the world, and in several countries they have discovered unique new variants of this virus. When we talk about variants, we're talking about the structure and the genetic material of the virus itself. And so far we have several variants, but 4 of them seem to be making things a lot worse than the others. And so it's important for us to understand about the concept of variants and the way it is affecting our public health and our public health policy. So in general, every virus tends to change throughout a process called mutation. It changes up a piece of the genetic material here, a piece there, and it is essentially an effort on behalf of the virus for it to survive and for it to become more powerful and more deadly. So far we have had multiple COVID-19 virus, or the SARS-CoV-2, which have been found across the world. And why are they a concern really to public health? Well, because of this severe effects that they can have. There is a lot of increase in the way it's transmitted from one person to the other. So transmissibility is increased. When it becomes active in the air and people breathe it in, or you become infected with it, you can have a much more severe illness, and the course of the disease can be much more dramatic with bad outcomes. Some of these variants have the potential of evading the tests and not showing up as positive tests if you become infected with it. And unfortunately, some of the new variants may not be susceptible by your immune reaction that if you recovered from one type of the infection. So let's say you have infection with the first or the original COVID-19 virus and you recover. When you recover, you develop, or you would have developed, certain antibodies or defense mechanisms against that original virus. But along comes a variant that is different, and your body can still be susceptible to that variant because the antibodies and defense mechanism that you would have developed have been developed against the first type, and you are not having any resistance against the second type. So that's a main concern, that persons can have a second COVID-19 infection once the two viruses are different, the original and the variant. And of course, they also respond differently to the available treatment that we have for COVID-19. So there are several reasons to be concerned because of variants. And these include the increase in the ability to be transmitted from person to person, the severity of the illness at which it can cause, its ability to evade testing, that you can't really pick it up, as well as it is not susceptible to the immune reaction you would have developed from previous infections. Important points about variants that should be known. The main variants that we have recognized, the first major one that we would have seen was what we call the British or the UK variant. Otherwise, that was seen mainly in the United Kingdom. And that has been there for quite a while. And since the recognition of that variant, we have seen other variants come on the scene. The next one that we recognize is from South Africa. And following that, much closer to home, we have seen what is called the Brazilian or the P1 variant. All of these variants shows the property of what we call gain of function, meaning the virus becomes more powerful, it can do more damage to humans. There is more efficient transmission from person to person. There is reduced antibody binding, and therefore you have less immune protection when you encounter a variant, as well as there is some claim that some vaccines used in the earlier stages may not be as effective against the variants. What we have seen play out across the world, however, is that the vaccines seem to be protective against all of the variants, despite the aggressive nature and the easy transmissibility from person to person. The aggressive nature of the latest variant, which is from India, seem to be making that virus so much more transmissible that they're outpacing the vaccination drive across the countries that are affected. So there are more persons getting infected much more rapidly than the public health system can actually vaccinate people. And that's a concern, because it's possible that health systems can actually become overwhelmed. So again, I want to encourage you, as soon as you have the opportunity to get your vaccination, please go and get your vaccines as soon as you have the opportunity. So we have changed the names of these variants or the mutated strains to not reflect the countries in which they were first recognized, but we actually give them Greek values like alpha, beta, gamma, delta, etc. The alpha variant is the one that was found first in the UK. The beta variant is the one found first in South Africa. The gamma variant is the one from Brazil, and the delta variant is the one from India. The four main ones seem to have increased transmissibility and virulence. That's meaning that they are more powerful. There are other variants of interest that we have seen, but they're not yet as prevalent as those four main ones. But again, these can cause community transmission or multiple clusters, and they have been identified in multiple countries, including the United States, in Brazil, in the Philippines, as well as in India. Several variants have been found. The new variant of the virus that caused COVID-19 has actually several mutations, and these mutations seem to change up some structures on the spike protein. The spike proteins, remember, are on the surface of the virus, and it allows it to bind to human cells and then enter the cells to create its damage. It reproduces itself or replicates itself and then become released and infect more and more cells. So all of the variants seem to be targeting the spike protein, the way in which it binds to normal human cells. So it is important to understand that mechanism, because if it's binding easier or it's becoming more and more sticky, it's easier for it to get into the cells and therefore cause more and more damage. The countries with the highest COVID-19 death toll has been quite remarkable when you study them. The United States, big country, lots of resources, but they have had a high number of deaths from COVID-19. In fact, for every 100,000 population, the United States have had 173 persons dying from COVID-19. And this is data from April 2021. Compared to Brazil, which would have had 177 persons dying per 100,000 population, Mexico 166, India, as of April this year, was 13. But as you know, in May, India had seen a devastating spike in the number of cases as well as the number of deaths from COVID-19. There's still a lot of persons becoming infected and dying from COVID-19, not just in Guyana and Brazil and elsewhere closer to home, but in faraway places such as India, etc. And remember, with global traveling becoming what it is, it's important to recognize that there is a potential for all of these variants to enter different countries. So we have to make sure that we continue to do safe practices, and the best way to protect yourself and your families from COVID-19 infection, the devastating effects of the variants, etc., is to make sure that you actually get your vaccination in time so that you develop enough immunity. So the mutating coronavirus has spawned several variants, and these have caused significant worry among the scientific community. The UK variant, for example, has about 40 to 70% more infectious nature than the other variants. The Brazilian variant is more contagious than the initial coronavirus strain, and it may be more virulent, meaning more dangerous, but we still need more data to establish that. The South African variant has been found in at least 20 countries, including countries in Europe. And there are several mutations within the South African strain as well. And there are some viruses, some mutants that are considered double mutations, where they have more than one type of structural change to the virus. There are some differences in the way the old and the new virus or the new mutant strains affect people. The old strain persons tend to have more fever, persistent cough, and surprisingly or interestingly enough, a lot of persons would have had a loss of taste and loss of smell. The new strain seems to have all of those associated symptoms, but also they are associated with more aches and pains, more diarrhea or gastrointestinal upsets. You may have more discoloration of the face, the fingers and toes. They come with more sore throat, conjunctivitis or red eyes, headaches, and skin rashes. So there's a lot more symptoms associated with these mutant strains than the original virus. All of them, however, seem to have fever, cough, and loss of smell and taste intact. But the new variants have additional symptoms that people can present with. It's important to remember that as doctors or physicians or healthcare workers, when we're encountering these patients. So the best way to prevent spread remains all of the basic things that we've been talking about. The number one way is to get vaccinated. The other ways are the simple things that we know of: washing your hands, keeping at least 1 meter social distancing, as well as wearing your mask. Before we go, I want to dispel one of the myths surrounding the COVID-19 vaccine, and people are running away sometimes with an impression that the vaccines will not protect against the mutant strains. Well, the viruses generally mutate over time, but all the data that we have suggests that the COVID-19 vaccines that we have will be effective against the emerging variants of the virus. Again, another reason to go and get your vaccine as soon as possible. Remember, if you have any questions or comments, please feel free to send a WhatsApp to 620-6275 or send an email to docandcovid@gmail.com. Thanks again for joining me.